Please know that we take no one's being here for granted. We are honored that each one of you takes time out to be here. 120 years ago, some gentlemen, and you notice I said all gentlemen, would gather a couple of times a month, and I don't know where it was. Dr. Mazur probably knows, in some remote building downtown for 90 minutes, and they'd talk about the public affairs of Chicago. We've moved from that to this. And this is a moderate room. You guys have been here. If any of you have been here where it's impassable, where you can't get past people, anybody been in the room then? It's kind of nice to breathe, right? But so we've moved from that to this, and we take no one's membership for granted. I was just talking to Michael, and he was saying that, he's just a member, and that doesn't mean, you don't have executives from, the financial institutions who are just members. So we appreciate everyone being here, and we take nothing for granted. So thank you so much for your membership. And if you're not a member, Omar is not here, but he would be happy to take your membership from you. So this part of my job is super easy because Brandis does this every night at 5 and 10 or 5:30 and 10, or is it 5:30? See, she's like, no, get that time right, Jackie. 5:30 and 10. So for those of you who happen to be home at 5:30, make sure that because they've changed some times at WTTW, so make sure you get your time right to watch her. I am going to decrease at this time. Dr. Ezike is all of our hero. Sarah Feigelholz just said to me that she's my shiro. And, it's a sobering thought to think that we made it through 20 and 21. And I think sometimes we take that for granted. But if you, like me and everyone else, had the TV on at sometimes it was 11:30, sometimes it was 2:30, sometimes it was 3:30. You saw Dr. Arty and then Dr. Ezike would come and give the numbers for the day. We're still here. And thanks to she and her great counsel and the work that she did, she's moved on to bigger and better and different things now, but we are grateful that she took on that job. So for that, I'd like to just give her a hand before she gets up here. It is still a rather sobering thought that, we thought, well, we can just bump elbows and not touch each other, and then we move from that to what we entered into. And there's no better person to have a conversation with than Brandis, because she just makes you feel like literally you're sitting in your living room having the conversation. So I am going to ask them both to come up to the stage at this time. And if you don't have your questions, there may still be some time to get some up to the podium. I cannot guarantee that Brandis will get to every question, but we will do our very best. Amanda will see you. She's in the corner. She will grab them from you and get them up to Brandis, and we'll watch our time and see how we're doing, okay? The stage is yours. You can, there's a step over here if you guys want to come over here, or you can just step up. Usually we have some chivalrous young man who's usually there. So the joke is we usually don't have a chivalrous young man up there. Are you guys mic'd and ready? Are they mic'd and ready to go?
I think so. Oh, there I am. Hello.
All right, ladies.
Thank you, Jackie.
You're welcome.
And thanks to all of you. Hello. How are you all? Oh, good. Awesome. And welcome to you. It's good to see you.
Thank you.
I feel like during the pandemic, a lot of us, obviously we got used to seeing her, right? And hearing from her. And as Jackie said, because I want to start where Jackie left off, you and Dr. Arwady kind of guiding us through this whole mess, right? And then you moved on. Congratulations. You've been there for a year. But I think we kind of miss you, right? Because we haven't heard from you in a while. You've been I know you've been there, but we just haven't talked. And so it's good to be in conversation now.
Thank you. It's good to be missed.
I do, like I said, I want to start off where Jackie left off, because you all have been following the news. And we know that COVID, it's not gone, obviously. I think a lot of us, we've gotten very comfortable, and we can do things like this now, right? Like we can have lunch together in a room without masks and without panicking, and everybody having, jars of antibacterial gel in our pockets. But give us a little reminder, right? Because there's a bit of an uptick that's been happening lately. And, kind of where our public, I know you're not necessarily directing IDPH anymore, obviously, and not serving the public health the same way you used to. But kind of remind us what we need to know and how we need to be thinking about this.
Again, full disclaimer, I'm not wearing that hat. And really, it's a big difference because I went from, talking to people from the CDC literally every day, talking to my counterparts. Is this?
We okay? There we go.
Counterparts around the country, all the 49 other state health officers, regularly texting real time, following the numbers minute to minute to not. But there are some things that obviously should be top of mind. Variants are a thing, and the virus will continue to evolve because that's what viruses do. So that's not a possibility, that's the fact. What we don't know is, what those variants will look like. Hopefully they're getting milder and milder, but, variants are a thing. My daughter, Adora, stand up. My daughter is here, and shameless plug, but I actually had a point to saying that. I actually was trying to say, because she's working this summer for a biotech company that's working on additional COVID treatments. So that tells you that, it's not gone. The fact that we're still going to need treatments means that people, are continuing to be infected. I think, remembering that vaccinations are out there and that people obviously do much better with vaccinations than not. I would throw out long COVID is something that we're all going to have to grapple with, as millions of people have been infected, and unfortunately a non-negligible portion of people have gone on to have long COVID or long haulers or whatever term is used. And so the medical community definitely has to wrap their hands around that, study that, research that, figure out some of the treatments that will be necessary to help people manage now what has become a chronic disease. I absolutely have physicians who are telling me that people have now come into their offices needing to apply for disability, that since that COVID illness, they have not been able to think straight to be able to maintain a job. So it is something that, is with us. But, as we did in the throes of the heights of the pandemics, we will work together to make sure that we can mitigate some of these long-lasting effects.
You just touched on it, like you're not following the numbers, sort of minute to minute the way you were. I'm kind of curious, you've been at Sinai for a year now after spending, 2 to 3 years very deep in, like you said, the height of the pandemic. I'm kind of curious about, how much of your time you spend thinking about COVID, how much that is affecting the people that you and the Sinai system are caring for, and kind of, how different your day-to-day is now, right? Like you've got other priorities.
Yeah, so we don't have as many COVID admissions, obviously. And in fact, the majority of people who do have COVID in the hospital, like maybe it was found out incidentally as opposed to them being brought in for that. I think one of the biggest questions that came up since I've been at Sinai regarding COVID was when we could relax the universal masking. And so I was like, let's get rid of the mask. And they were like, huh? Wait, huh? And I was like, well, we do have to evolve to that point. We were sure to not be the first hospital system, but as soon as we saw some others, we're like, okay, we're next. So that was the big thing. But we're fortunate that does not make up the majority, anywhere near the majority of hospitalizations or even a significant number. But the fall and the change in weather as temperatures drop, like that's the time that these viruses usually tend to have their uptick. And if we're going to learn anything from the previous upticks we've had in all the past years, that uptick in the fall. So again, it's hard to know exactly what's coming. There might be something that's coming, but we'll have to kind of wait and see. And then one thing that we always did at the state is, I kept in contact not just with my state counterparts, but my partners overseas. Like my friends in the UK were seeing things several months ahead of us. So looking to see what's going on there can also give us a little bit of an idea of what might be to come, what might come here.
So shifting to what you've been up to the last year, how's it going? Why did you want to lead Sinai?
It's many times I feel like the work that I get to do at Sinai, and I'm so privileged, and I have many of the board members that actually put me in the role. Thank you to the board of Sinai. It's a continuation of the work that I've done since I decided that I wanted to be a doctor. When I went into medicine, I knew I wanted to take care of people, and so you're thinking about, what field, and I wanted to be able to touch as many people as possible. And so that I made the decision to do both internal medicine and pediatrics, so I could do from just out of the womb to the other end, and really be able to focus on people that have often been neglected. So, going to county and saying that's where, they take care of everybody without respect of, what's, doing the wallet biopsy and figuring out what kind of insurance you have before you decide what kind of services. County didn't do any of that. And Sinai, which is just a mile and a half away, is the exact same way. Even though it's a private, it is absolutely taking everyone, welcoming everyone in the doors, regardless of the ability to pay. And that's a very intense mission that is hard to maintain because these services do cost, but they have maintained that for 104 years. And so I'm so honored to be able to further that work.
And so what you just mentioned, right, about, people being able to come to Sinai and get care, right, despite all the ... who's your insurance, do you have insurance? And I was doing some research on the term social safety net hospital, right? And I found an article that says, it's hard to define, right? Does it mean this? Does it mean that? And I guess I'm kind of wondering from you, do you consider it a social safety net hospital or safety net hospital, essential hospital? And does it matter how we define it, right? Like, you do what you do, and would a definition help you do it better? Funding, understanding, support.
I think it is important that we understand how Sinai is different from some of the other hospitals. I think if we don't understand what Sinai does, we can't really appreciate the depth and the complexity of what we are doing, how we're doing it, and what we need to be able to continue doing it. I actually will tell you that on the federal level, they are looking for a special designation for hospitals like Sinai that are in an urban setting, taking care of majority Medicaid. We take care of almost 70% Medicaid. That is not, if anybody is going to open a hospital business, that is not what you're looking for. But we are taking care of 70% Medicaid. And then you would say, oh, well, the rest is private insurance. No, like maybe 5% is private insurance. So we welcome anyone here because I'm sure you have private insurance. So we have Medicaid, small amount of Medicare, and almost no private insurance. So really thinking about how we are really supposed to keep the lights on and keep people paid and make the necessary upgrades on Medicaid reimbursement as opposed to, private insurance. Like, that's math that doesn't really work. And so it is important for everyone to understand that that's what we're doing. And so at the federal level, they're talking about a designation, Metropolitan Anchor Hospitals, to describe hospitals like us rooted in the city, often in urban, very urban areas, code for often, under-resourced communities where it would be largely Medicaid, and really think about how do we want to support these MAs, these essential hospitals, these safety net hospitals, so that the people who are served by these hospitals, who right now, the people who are served by Sinai have that 16 years loss of life compared to people who live here, right, where we're eating now. And so if we believe that that's a problem, I do, and I'm sure that many of you do, then what do we need to do for these MAs, these essential hospitals, these safety hospitals, to allow them to be able to support that population? And of course, we all know it's not just the healthcare, and that's something that Sinai recognizes and has been recognizing for a long time, that there are so many pieces that are necessary to make sure that that 16-year loss of life between the communities that we serve and just coming here downtown, that we can do that in the healthcare space, in the job space, in the transportation space, in food space, housing space, all working all of those pieces together to affect a better outcome for the residents of the southwest and west sides of Chicago, just understanding that a rising tide lifts all boats, and Chicago is only as great as, the areas that are the weakest, and we need to bring all groups up.
Meanwhile, so you mentioned 70% of your patient population is on Medicaid. We just ran a story last night that for a lot of people, the redetermination is happening for people who are on Medicaid, and thousands of folks are coming off of it, either because they didn't complete the paperwork or they're no longer eligible. You may watch that story on news.wttw.com. But so you've got that, right? And so that's only one example maybe of how the federal support that hospitals like yours received during the pandemic, how some of that support is going away. And really that was just, sort of a rule that was laxed, during the pandemic. What does it mean then, though, if instances like that and, any other funding that's not happening anymore, what does that mean for the people that you serve?
Yeah, so every single day we're, on this shoestring budget, and any mild perturbation can be very seismic for a place that doesn't really have, big margins. So the redetermination is something that we talk about every single day, because, it is fantastic that during the height of the pandemic that nobody on Medicaid lost their insurance, and that was really important. That is the time in history where the highest percentage of people were insured in this country. And you would want it not to be that only in the midst of a pandemic that you would have people with that access, but that's what it was. But now, the day of reckoning has come, and it's not even so much that people don't qualify anymore. Some of those people don't qualify. Like if you've gotten a job that has, work employer-based insurance, fine, use that. But some of it is just that, you're not at the address that you were 3 years ago, and that's where we sent the paperwork, and you didn't get the paperwork, you didn't fill it out, you get thrown off the roll. So that's some of the things that we're facing, and that means that those people will still come and get care because we don't turn anybody away, but it means that there's even less reimbursement for a system that's already, really stretching out everything. And so really thinking about, what are the other ways that we can support systems like ours, because we want them to increase the services and resources that they give in the community and not keep figuring out what to cut back in order to keep the lights on.
Let's talk a little bit about some of the community partnerships that Sinai has. What are some of them? Tell us about that. Well, and there's one in particular that I'm interested in. That's the community health workers. But from your perspective, I'm sure there's a ton. I'm curious about how those partnerships serve Chicagoans.
I absolutely believe that there's no way, I don't think anyone should survive without partnerships. I think it's all about partnerships. I think almost everyone in this room, you somehow have a partnership with us. And so I think that is what did I just hear? I think Commissioner Deere just said it yesterday, or somebody said it, like, if you want to go fast, you go alone, but if you want to go far, you go with people, right? And so this work is so critical, it can't be done alone. It depends. It depends on partnerships. So there are endless numbers of partnerships, and my job, I feel like, is to identify and create more possibilities for those partnerships. We need more people at the table. We need corporate sponsors to say, hey, I have a strong presence in the city of Chicago. I'm invested in supporting Chicago, all of Chicago, all parts of Chicago, and I want to invest in helping you take care of the patients that you serve. We have great partnerships with foundations all through the city that are very generous and kind. We have individual sponsors and partnerships, companies, corporations, other health systems. I'm really trying to increase the relationship between Sinai and other hospital systems, especially, some of the more resourced hospital systems. I think they have an opportunity to be able to really have even greater impact. When we were talking about health equity, look to me, look right here, look no further than Sinai. 100%, 98% of our patients are Latino, African American, and really have some of the worst outcomes. So if we really want to make a dent, supporting us is a great way to get there. So we are open for partnerships.
Open for partnerships. There's one audience question that fits in right here. Someone asks, can you touch on the importance of partnerships, which we just discussed, not just linkage agreements with local smaller businesses to move your agenda forward. So I'm curious then about, obviously a lot of your partnerships, like you said, with foundations, I imagine a lot of community-based organizations, but are there businesses and what is their role?
No, of course. We're intentional about trying to support businesses in the community. In fact, we are part of creating, very creative business mixed with civic organizations, with the city, with the philanthropic organizations, with private business, where we've created a Ogden Commons building across the street from Sinai, which has medical use. We have clinics in there. We have dialysis. We also have a space for a restaurant to encourage a business from the community to come and take up shop there. There's a bank. There's a coffee shop. And then the next phase, which they've already broken ground on, is to create 92 units of affordable housing. So really understanding that these are all the things that are necessary. And, we have other projects that are coming right behind to bring a grocery store. I mean, I know many of us are in places where you can't imagine not having a grocery. I could go to Trader Joe's or Mariano's or like Whole Foods, like all within a mile and a half. And to think of neighborhoods not having a single grocery store, like that is a real reality in many of the communities. And so being able to think about how we're going to create the partnerships to make that happen, that's something that we spend a lot of time on as well.
So I mentioned the community health workers and the Sinai Urban Health Institute. SUI, which is just cute to say. I lived in Arkansas for a while as well, so some of you know what SUI also. Thank you, you get it. So I want to talk about like the community health workers, the work that they do, but also how they impact health outcomes for the people you serve.
Yeah. So I don't know if everyone knows what CHWs, if you want to use another term to show you're
I had to look it up.
Community health workers, but there are very few things that are a win-win-win-win. And community health workers are...
There you go. Win-win.
are one such entity. Community health workers are individuals who, in most cases, don't have a college degree. They're high school graduates who get an intensified education and training on being a support in the community. Sometimes there could be a focus on asthma, or it could be something related to pregnancy and the perinatal period. And those individuals get trained. I'll tell you that at SUI, at Sinai, is one of the architects in terms of creating curriculums for community health workers, being able to train community health workers, and then being able to do the research to prove that they actually create big ad. And so community health workers, for instance, at Sinai, and this is something that we've been doing for decades now, community health workers have been proven that they were sent to follow up on patients after they were discharged with an asthma hospitalization. So you had asthma. Asthma does literally kill people. You survived. You were discharged home. Do you have the information and the tools that you need to ensure that you don't bounce back and get readmitted? And so these community health workers that were specifically trained in asthma follow up in the home. There's the community part of the community health workers. They are from the community and they're going into the homes of people in the community after discharge to check on them and say, hey, did you get all the inhalers that you were supposed to have? Did you get the prednisone? Did you get this medicine, that? Do you understand what you're supposed to be doing with that? Do you have a number to call? When is your follow-up appointment? It hasn't been made. Let's make your follow-up appointment so we can make sure that that little touch, that warm touch, that follow-up in the home with somebody from the community resulted in a 40% decrease in asthma readmissions, right? And so they have that kind of data for all the interventions that these community health workers are doing. And so the other side of it is that this community health worker now has a very valuable skill as part of the health team. They are literally making a difference in the health of their community. They are gainfully employed with a livable wage, with benefits of their own that they can now take care of their family and have insurance for their family. And so I always think of that as just this, tremendous win. And so we're trying to really promote that and also get insurances to be the ones to pay for these services, because this is an important part of the health milieu.
What are some of the challenges with running a program like that? Because in my head, I'm like, is it wages? You mentioned benefits. Yeah. The job description I read can kind of be confusing because different communities and organizations may describe it differently. Training and career development and advancement, funding. Go on. Where are they?
All of that. No. Rewind, a year and a half, and we were talking about that at the state. Like, can we create a certification program so that everyone who's going to call themselves that has gotten this set of pieces of education, and that, is there a test or something so that we can standardize this? And thinking that that would be the first step. Having some kind of accreditation or certification program that from there you could move on to getting actual reimbursement from insurance. So there's a lot of work to be done on that. In the meantime, whether we have that or not, or the reimbursement, this is an important adjunct, very critical part of the healthcare team. And given what we went through with the nursing shortage, when so many people either left the workforce as a nurse from really the trauma they were facing dealing with COVID, versus people who left to be traveling nurses, there was a significant shortage of clinicians, of nurses. And so those community health workers actually, they're not nurses, but they were able to help and really extend the staff that we did have with some of their support, because we're starting to bring them in the hospitals to help them with, patients in the hospitals, as well as, in the community. So I think there's just I would say limitless possibilities and opportunities with this, but we do need the support, the funding, to be able to make this sustainable.
As long as we're on it, because I had that question, what would a more sustainable funding model look like?
For safety nets, for community health workers, obviously, we need them to be able to reimburse for their services like other members of the medical health team. Right. In the absence of that, safety nets are bearing a big brunt because we are using them and we are covering them without having really the extra resources to cover this. I think we're all friends here, right?
We can talk. It's just us.
It's just us girls, right?
Yeah.
I think the real question is, when you're thinking about safety nets or MAWs or essential hospitals, do we really think that everybody deserves adequate health care? Yes. That's the question that's at stake. Yeah. And I'm not sure that the answer is yes. We don't act like the answer is yes. We have a tiered system of health care based on who you are, what you have, where you went, do you have education? Do you have money in your pocket? What kind of job you have? We don't actually think that everybody gets the same. We are literally often fighting to say, look, I know this is not covered, by this insurance, but it is covered by someone who has this insurance. But this is the same disease, whether you're poor or you're rich, right? And so treating it differently, not having access to the same medicines, not having access to whether it's continuous glucose monitoring or whether it's this medicine or that medicine, that tells me that we don't actually think that everybody deserves the same care, even if it's for the exact same illness. And let you in on a secret, these people who have traditionally not had access to all the things that someone over here has, their conditions have gotten worse and more severe. So if anything, they need more, and instead they're on the side of getting less. And so that's really what I feel is my job, to raise raise visibility to that issue and really get that that communion of people that believe that and say that we're gonna do something about this so that we can stop just talking but be about something. Yeah.
Before I move over to audience Q&A, because we have a few that have already been submitted, I think I asked one of them. I'll come back to the other two. We have to talk about violence. Because Sinai is known for being a hospital to receive a lot of victims of violence because of its position, and as we said, people can get care there. But in addition to, to treating the victims of violence, right, in the acute days, like when they come to you with something, what does it mean for the people who live in a community that is plagued by violence? What is their health like?
Yeah. I think we're all starting to understand the effects of trauma. I think we're getting a deeper level of that now because we all went through this intense traumatic experience, which was COVID. And I don't think that there was anyone who comes out of that completely unscathed. There are obviously levels, but we've all been traumatized. And so if someone wants to, put on their empathy cap and their compassion cap and think about what they've been through in terms of the trauma of seeing such devastating illness and loss, and then can extrapolate that to people who see that daily, even before there was COVID, and have consistently seen that in certain communities just day in and day out for generations, I think you can start to understand how significant those effects would be on not just an individual, but a community of people that are all experiencing that together. And so really thinking about how obviously we want to curb the violence, right? But in addition to having to curb the violence, we need to figure out the strategies to support those who are enduring that. And I think some simple things that people can do, just, think about on a regular basis is, knowing who you're interacting with. I mean, you can't look at someone and understand what they've been through or what their experience is. And that's why I think it's so important to, people, I got in trouble once, sidebar, I got in trouble once because I was asking so many questions because my style is very relational. And so I get very nosy. I want to know about family. I want to know about your kids. And then I'll be asking, and I often remember birthdays because if it's the same as my kid, then I'm sending you a birthday card for your kid because I know it's the same as my kid. But I got in trouble because I was asking all these questions, and someone reported me to HR and said they were just very intrusive. And I'm like, oh, okay. So we don't need to work together, and we fix that. But the truth is that, if you don't know, who you're working with, what you're dealing with, you can't get beyond surface level. You can't understand that the reason that they were just kind of acted out of pocket, out of themselves, was because something triggering just happened. And that, when you talk about, gun violence, this mother's son was killed 3 years ago, right? Just really understanding. So, I always say, people don't care what you know until they know that you care. And so I think you have to care. You have to go a little deeper, get to know people, and then you can kind of get at what people are, if you've developed that relationship, people can open up, and then you can actually get to a place of being able to support somebody who's going through a lot. But obviously we need something systematic, system-wide, statewide, countrywide, worldwide, to really address mental health, destigmatize, be able to talk about these issues very openly. I know that the mayor is really lifting this as a major issue and trying to figure out how we will address this. He's talking about mental health centers, and whether we have mental health centers all across the city or we're using, the services that are available at places like Sinai, there's a lot of work to be done in that space. I know that was really long answer.
No, it's okay. It's totally okay, because that's what we're here for. We're here to hear from you. And did you guys hear that? I wrote it down. People don't care that you know until they know that you care. Hi, Amanda. Hi. That's a good one. Okay, so I am going to pivot to, that's my subtle hint, to pivot to audience questions, Brandis. One of them we already asked, and this one I meant to ask earlier and I skipped over. If you had to do it over again, is there anything you might have done differently in addressing the COVID epidemic in the state of Illinois?
Can't get past that one.
Can't get over COVID.
Yeah, everything, sure. I mean, I don't know, like, I've gone into restaurants. I try to think that I'm low key, especially when I change up my hair. Then you don't know who I am, because a lot of people are like, "You look familiar," and I'm like,
Yeah, I get that a lot too.
Right? And so then I can try to book before they realize, But I've sat in restaurants and then, the owner will come up. "I know who you are." And I'm like, "Oof, yeah." It's like, "You messed me up." And it's like, it was, of course, so many restaurants didn't survive. Like, I get that. I think the premise I was starting with was that, if you can try to minimize the loss of life at the front, then at least you're alive to try to fix the downstream effects, right? But if everybody gets infected and dies right off the front, there's nothing to fix. There's nothing to fix. But either way is tough, right? I knew some people that were saying, like, all this attention on nursing homes, whatever, they've lived their life. And I'm like, I guess that's one way. And people were like, let the strong survive, let the weakest fall off. And you're just like, okay. There are different ways, right? There's so many ways to slice that. I think, I tried to listen a lot. I think, thinking about the restaurants specifically, who I know really suffered, if we could have, if we could have given them money right at the outset to say, here, as if there's unlimited pockets of money, right? But if we could just give out money and say, here, we've seen that some of these bars, these crowded bars, have been super spreader locations. Like, we've got to get this under control while we're still, trying to get vaccines, do this, do that. Can you partner with us on this? And, maybe we can support you this way. Like, maybe that could have had some more of the buy-in instead of, people just kind of doing whatever they want because they felt like they were being attacked because they were in a business that, was identified as a quote, risky business. But yeah, I second guess myself all the time. But obviously, I would like to say that I was doing the best that I could, assembling all the information that I had. In hindsight, being 2020, it's so easy for everyone to be like, yeah, that wasn't right. And I'm like, yeah, I wish I had that, opportunity to see the future too, but I don't.
And we're here now.
It's not my superpower.
Yeah. Another question, and I feel like we've kind of been talking about this, and so maybe we can sum something up here, and then we can try and get to the other two before we're out of time. This question, she makes a great point. The need is so great. Where do we start to begin to meet the challenge of health inequities across the city? What is the role for all healthcare institutions? And I think you've talked a bit about, about what Sinai is doing. Yeah. What is the role of all healthcare institutions?
No, I think we did something pretty amazing in COVID, where the healthcare institutions were, especially in the city of Chicago, it really wasn't about this institution or that institution. Like, all the institutions were coming together to figure out what can we do together. There were, I will highlight my buddy, my partner, Dr. Omar Latif, who at Rush, just would take any COVID patient from around the city, anybody that needed a bed, that needed the extra services that maybe a smaller hospital couldn't do. He took that, and there was just the work that was put together to create the. I can't believe I've forgotten the name, but they created it wasn't a hospital, but it was a medical outlet at McCormick, where people could go if we had this, significant overflow and exhausted every bed. All the health systems worked together to put that together, to have that plan in place. Fortunately, we didn't need it because it didn't get, that bad, but we worked together to have that backup. And so really just kind of putting that mindset back together and figuring out like it's still that same one Chicago. We still really do have this existential crisis where we have some members of our community that are not faring well. And I think there's opportunity for collaboration. I think we're moving in that direction, and I'm really hoping that we can make some significant strides all working together.
This question, as I work with families living with developmental disabilities, what are the side effects of the COVID vaccine and booster?
Yeah, I mean, we will be seeing. I know when people would ask, well, what's going to be the side effects of the vaccine 10 years from now? It's like, I can't tell you because no one has had it. I can't say definitively. I think as we move forward, we will see the effects. I know one of the effects of the vaccine that we're seeing just, 2 years, we got the vaccine December 2021. Mm-hmm.
Yep.
No, December 2020. We got December 17th, 2020. We are 2.5 years out, and we do see such a significantly decreased rate of morbidity and mortality. So that's a fantastic side effect of this vaccine. The long-term effects, usually this is just vaccinology. Usually the untoward effects of vaccines happen in the first 8 weeks. That's what we know from other vaccines that have been out there. And so you think that most of the severe mal effects you would have seen. But can I say exactly what will happen to the developmentally disabled population several more years out? I'm not able to.
Science hasn't told us that one yet either.
Right.
I think we've got time for one more, and this one is a good one. And I don't usually call out the people who wrote the question, but it's a good one, and I might need help with your handwriting. Dr. Ezike has illuminated the health disparity reality like a Michelangelo statue from the stone. Did I get it right?
Say that? Does that really say
Dennis?
that?
Yes, thank you. Oh, there you are. Hi. What can we do?
What can we do?
What can we do?
Well,
and I was going to ask that question anyway. What can we all do? What can everybody be doing?
Yeah. I think we all need to be aware of the issue. I think hopefully many people are. And then we need to figure out within our sphere, what's our role? Everyone's role is not the same, right? We have some people who are part of organizations that are able to support some of these communities that we know are struggling. We're 77 communities in Chicago. We know the ones that have more issues with housing insecurity, food insecurity, have transportation issues, have a higher rate of people re-entering from incarceration. So we know the communities that need help. I think people have to ask themselves, what is my niche that I can insert myself, my organization, my corporation, my dollars into to make a difference? I'm not here to plug Sinai, but yes, obviously Sinai has a lot of opportunities for people to support that work because Sinai doesn't just do healthcare. Like I said, we're working with the community health workers. We are in the community already working on all these different pieces, understanding that healthcare is not just the result of what happens with the doctor or the nurse or inside the walls of the clinic or the hospital. But I think there are so many places, whether if you're in the education space, if it's really supporting education. I mean, if we go there, there's so much, right? I just, my kid is preparing for school, and at their junior high, everyone gets an iPad. Everyone gets an iPad, and that's how a lot of schoolwork is done. And then you have certain schools, in the communities that are served by Sinai, where people are struggling to get books. And so really looking at whether it's at the civic level and making your voice heard. And I know we have so many of our wonderful legislators here. Thank you for your support. We have to make sure that we start early. The problems that we see downstream started way back with some of the opportunities that weren't granted to people as they were coming out of the womb. And so if we look at all of those different steps, there's so many places to intercede and intervene. And I think we need to start doing that with some significant intentionality.
Help me thank Dr. Ezike. everybody has their walking orders now. Thank you to Dr. Ezike for allowing me the opportunity to have this discussion. I think we'd only met once or twice in person before the pandemic, and then after that, all of our interviews were via Zoom. So it's good to be back in person with you. I'm going to turn it back over to Jackie now.
Well, I'm a little biased, but these are two pretty awesome ladies who, Senator Feigenholtz, I see what you mean. And just so you know, we were sitting at the table and she gave me some advice. So Dr. Ezike is kind of awesome. We were just talking about that sitting at the table. How many other healthcare institutions are represented here? Lori's, somebody else back there. Oh, that's right. We got plenty of folks here. The comment that Dr. Ezike made that, is an healthcare issue is a healthcare issue is a healthcare issue. If you've got high blood pressure, I think Peter and I don't look the same, but, and I don't know that he has high blood pressure, and neither do I. But, it's still high blood pressure, right? So thank you for sharing that with us. And there's so much more. She's just so awesome. And I use that word because I don't have another awesome word to use. I feel like, Deborah, I'm not sure if your question was completely answered, so feel free after we're done to it was about disability, so if we could talk a little more about that. I did have a question, and I should have probably asked it. Are we supposed to be getting like a booster?
Yes.
I actually don't know if something new came out. I know that everyone in here has a different, history, and so they're governed by different rules based on age, based on what, medical conditions, et cetera, and then also like what you've already done. And so I think, I take that back, because some people could just have had two, some people could have been on their fourth, or, so we could talk offline, but I
feel like I'm on my 18th shot, but
We'll figure it out, and then you can watch.
We'll figure it out, right?
Tell you.
Right. Brandis, what time are you on tonight?
5:30.
5:30. Please don't miss Brandis. We will continue this conversation as we do most. That's what we do here at the City Club of Chicago. We have the conversation. So I thank everyone for being here. We have a couple of things we have to do. And that is to share our certificate of a year membership to both of you. And I hope that you both use them.
Thank you.
Brandis, I think Brandis is starting to overlap. She's got like a few.
I think my last one is just expiring.
Okay.
My last free membership.
And we do encourage folks to use them. So I think this whole conversation about healthcare is much of what we talk about, by Wheeler, is what we talk about in Chicago as a whole, right? 77 communities, and we certainly don't all look the same, but we certainly should be getting the same healthcare at a minimum, right? Isn't that right? I mean, that's right? Yeah, I think so. So that said, I feel like Amanda is always working on great programming. You will see more coming. Dan and I were just talking. It seems like this is a conversation that we still need to have more conversation about. I'm like, is it like my flu shot? Do we, I figure if I made it through the shingle shot, has anybody else had that? Did anybody else go home and go to bed after that second one? I was like a baby. It was terrible. But I figure if I made it through that, I can make it through anything. So let's make sure that we all take care of ourselves wherever you get your health care. Just make sure you're taking good care of yourself. Thank you so much for being here. And we look forward to the fall lineup. Please take a look at it. If you want to be here, make sure you get your seat early, okay? Thanks so much. And we're going to do a quick picture up here, and then people can come up because I know they're going to talk to them.